Doctor, I'm hearing voices in my head again. Doctor.
Hello, Dr. Queeneth. Welcome to our channel. Today we'll be talking about PTSD and want you to shed more light on it because a lot of people, especially in Nigeria, are suffering from this condition. And the worst part is that we have few therapists that help people or patients in such situation and such condition, and even the ones that are available are very expensive. So we just want you to shed more light about post-traumatic stress disorder. Thank you.
Hello, everyone. Good evening. Thank you so much, Sonia, for the opportunity to talk on this beautiful platform. Well, talking about the topic post traumatic stress disorder is a very, very important topic in our society today that needs to be discussed about helping people to know exactly what this is and how to actually overcome this. Now, post traumatic stress disorder is actually a psychiatric disorder that occurs after an individual has been exposed to a traumatic event that came with so much intense horror, or fear. Most times, such individuals, after that experience they have had, normally have this withdrawal syndromes and they keep on having nightmares or flashbacks about that particular event that happened to them. Now, take for instance, in a home where a child stays, where his or her mom is being abused constantly by the father, that is already a traumatic event, and there is no way you would tell me that child won't keep on recounting that event over and over again. Now we've heard about the case of late Mrs. Osinachi, who was being brutally abused by her husband in the presence of her children. This is something that could actually affect those children later in life. If not now, later in life. Obviously, it's affecting them now because their mom is no more. Who are they going to meet for all the motherly care and love that they're meant to get from their mom? So that is it. Now, there are a lot of individuals that are actually predisposed to such this kind of condition. You have mostly young adults. Now, that's where you talk about epidemiology, like the occurrence of this particular disorder. Mostly in young adults. It occurs mostly in young adults. It also occurs in soldiers, combat soldiers, those people who go for war. And then it also occurs in assault victims. And then, yeah, basically young adults. Take for instance young girls in our society who are being raped, because rape is actually a sexual practice without consent from the partner you want to engage in that practice with. Now, young girls who are raped by a group of men, or even if it is one man, that particular event, that particular traumatic event actually leaves a stigma or a mark in that girl's life. No matter how she tries to overcome it or suppress it, it still has a stigma in her life. That is actually one scenario where that post-traumatic disorder can actually arouse from. Now, in combat soldiers, obviously they are combating the enemies, try to defend their countries. Well, people actually take soldiers to be strong-hearted people, but they are humans too, and there is no way they will not keep on having those flashbacks and nightmares about how the warfare was, how many people were killed, even close friends were killed, and the rest of it. So that is just a general problem in the society that is actually hidden for now, that people do not really know much about. So now, this post-traumatic stress disorder actually can be classified into three basic parts. You have the acute phase, you have the chronic phase, and you have the phase with delayed onset. Now, talking about the acute phase, acute basically means when something when it hasn't really eaten deep. But when something is chronic, it means the thing has actually eaten so deep into the person's personal life and all that. So now, for the acute phase of post-traumatic stress disorder, such individuals start having symptoms for less than 3 months, while the chronic phase, the symptoms have been present for greater than 3 months. That means the individual has started experiencing symptoms like flashbacks, withdrawal from the public, trying to avoid those places that would keep on reminding them of that particular event, because these victims most times avoid places that will keep on reminding them of that particular event. They start withdrawing from social activities. Normally when they're meant to hang out with their family members or have some fun time or family time with their family members, you find out that they cannot do any of this so effortlessly as they would have done before. So now you also have the third classification being the one with the delayed onset. And then since this particular part, the symptoms normally begin 6 months after the event has actually occurred. Now, basically, people would keep on asking, what are the remedies for this particular monster? Because it's a monster that's actually eating deep into our society, of which people do not actually know and people are not actually aware of. Now, what are the remedies for this particular monster? Now, you have some drugs, obviously, to treat this post-traumatic stress disorder. You have antidepressants that help to treat depression, because this post-traumatic stress disorder is a predisposing factor for depression. Obviously, when the person has experienced a traumatic event, what happens next? The person starts going into depression gradually, and suicidal thoughts come into the picture. So that's it. You have antidepressants like imipramine and amitriptyline can actually be taken as a treatment or remedy for this stress disorder. You can also take beta blockers like propranolol. Lithium can also be taken. Anticonvulsants may also be taken for an effective remedy. And also there is an important thing that should actually be done, because it's not really all about taking drugs are very, very important, but we should also remember that drugs are poisonous and with side effects. So there's something called psychotherapy, like helping the person to build up his or her psychology, probably engaging the person in some activities that could actually help the person come out of that situation that he or she may find him or herself in. So you could have some support groups, actually educating people on this. You could have some family therapy and also other things, because these are just adjuncts to those pharmacological treatments that you can give to the person. So that's basically it about post-traumatic stress disorder. Well, in a nutshell, no one is actually an island of his or her own. No one is an island of knowledge. So basically, there are some other information that could actually be beneficial concerning this topic. But, well, I have exhausted the one I happen to know right now about post-traumatic stress disorder. So I feel we should spread the news. We should try to help people out of this situation, because indeed this is a monster that needs to be caged and destroyed. Thank you so much, Sonia, for allowing me or giving me the opportunity to be on your channel. May God bless you. Thank you.
Not to mention, Dr. Queeneth, thank you very much. It was a great pleasure to have you with us. I learned a lot, and I'm sure everybody that watched this video learned something too. And to you all that love this video, please don't forget to share, don't forget to like, don't forget to subscribe. Thank you very much.